Good afternoon, and thank you for joining our media briefing. I hope all dads had a great Father's Day. I know it's my favorite holiday of the year. This weekend was also the first day of summer, and we know people are itching to get back out into the open air. It's all very tempting to live in San Diego with our great weather and our beaches and parks. And while we have loosened restrictions to allow people to enjoy the outdoors more, we can't stress enough that the pandemic is still with us. Coronavirus is infecting people and unfortunately putting them into the hospitals and to ICUs. We know it can be uncomfortable to wear facial coverings, especially during the summer. But as we have cautioned, the fact that certain businesses can reopen and that more activities are allowed doesn't mean that we can let our guard down. The events of this past weekend bear that out. Yesterday, we reported 310 new cases for a positive rate of 7%. Now, we've been averaging slightly under 3%, so you can see that this rate going up to 7% is very concerning. We're not alone. The rate of cases have been on the rise in the southern and western parts of the United States. This virus is very stubborn, and it's certainly hard to contain. That's why continuing to urge you to take precautions like wearing facial coverings, washing your hands, and maintaining space from others is something we're going to keep talking about probably at every one of these briefings. Protect yourself at all times and help protect others. With more information on the case numbers and other data, we'll start off with Supervisor Nathan Fletcher.
Thank you, and good afternoon. On Thursday, when we last spoke to you, we met with you because we had, for the first time under the coronavirus pandemic, hit one of the triggers, the trigger related to outbreaks. We said with you one day didn't make a trend, and it would be important to monitor, in particular, that metric throughout the weekend and into next week. There was a possibility that perhaps on Friday that number would drop below the triggering number of 7 new outbreaks in 7 days. That did not happen. That trigger has remained in the negative position for the last 5 days. Today we will be reporting 10 new community outbreaks within the last 7 days, and so that number continues to increase as opposed to decrease. We're also seeing an increase in cases and an increase in percentage of positive cases. These are concerning numbers. They're concerning because they clearly represent an increase in spread, community spread, and number of cases tied to our reopening and the fact that more people are out doing more things. We're also concerned about the number of folks that are out without observing physical distancing and face covering. And it is important to note that the effort and intention behind what we are doing as we reopen is to preserve the integrity of our healthcare system. And to date, we have not seen an increase in our hospitalizations or ICU utilization from COVID. But it is equally important to note that hospitalizations and ICU usage is usually a lagging indicator after we've seen an increase in cases and after we have seen an increase in outbreaks. And so that is something we're going to have to monitor very closely in the coming days and weeks so we can monitor the impact on our healthcare system. But our message to the public today is very clear. The dangers from coronavirus are real. They are present, and we are seeing increases in cases, in percentage of cases positive, and in community outbreaks. And we continue to implore the public to please heed the warnings and advice, the things that are put in place around face covering, physical distancing, hand washing, temperature checks. The only way that we can ensure a smooth and steady recovery is to manage and contain our spreads. And we have these metrics in place to give us early warnings on potential concerning areas or problems. And so we will continue to monitor all of them. So again, the number of cases, the number of outbreaks, the percentage of positives are not headed in the right direction. We have not yet seen the impact on hospitalizations or ICUs, which is very important, but we are aware that that is a lagging indicator behind significant increase in cases, and so we will be watching that closely in the coming days and weeks. Let's jump into our charts today. We have today we're reporting total testing of 5,831. This is well above our average or our goal of initial goal of 5,200. And our 7-day average, obviously, you can see there's 6,867. This was pretty inflated going back about 4 or 5 days with large batching of tests that were all reported. We had a few days of over 10,000 tests. That wasn't 10,000 performed on an individual day. That was catching up of a backlog of tests. There also continues to be a lot of instability in the daily number of tests, number of tests getting reported, which could have some impact on the cases and percentage of positives. Contact tracers, you can see at 486. We're now over our initial goal of 450. With more than 13,000 investigations performed, and our treatment rooms remain available. Today we're reporting 302 new positive cases, 302 new positive cases out of the 5,831. This is a 5% percentage of testing positive. You can see yesterday was 7% percentage of positive. Prior to that, we had been pretty consistently in the kind of 2 to 3% range for a considerable amount of time. For perspective, our 14-day rolling average on percentage of positive is 2.9, and so we've had 2 days, and again, we need to see trends over time, but we will continue to monitor this, and this will provide greater clarity when there's greater stability in the testing. On hospital census, again, not a significant change from yesterday. COVID ICU is up just a few, non-COVID ICU is down just a few, and again, this alludes to what I spoke about earlier, which is the COVID hospitalization numbers have remained very flat and stable going back for a considerable period of time. And so that is encouraging. Of course, we want to continue to watch this if we see increase in cases and outbreaks and spikes to see what impact that has on hospital capacity. Going to the next chart again, you see us holding relatively flat and stable there. Total hospitalizations, both COVID and non-COVID, hovering right there around the 4,000 range, well below the 80% capacity. And then a pretty significant drop in non-COVID related ICU, you'll see on the next chart here. Non-COVID ICU, our COVID ICU went up just a few, not significantly, holding right there around 150, 152, which is about where we've been for the last month. Pretty big decline in non-COVID ICU utilization, which brings our ICU bed capacity down to 62%. Again, 80% there being a very important metric for what we're doing. So that concludes my section of the report. I'll now turn it over to Dr. Wooten for a Public Health Officer's update.
Thank you so much, Supervisor Fletcher, and welcome everyone to today's briefing. Global, national, and state statistics are based on the data that we retrieved from the Johns Hopkins dashboard and was attained today around noon. Globally, there are over 9 million positive cases, including 470,000 deaths. Nationwide, the United States is reporting almost 2.3 million positive cases, now at 25% of the global number, and includes over 120,000 deaths. Statewide, California is reporting almost 179 positive cases, which is 2% of the global number, and includes 5,518 deaths. And today, the County of San Diego is reporting 11,096 cases, which is 302 more cases than reported yesterday, and includes 338 deaths, with no new deaths reported since yesterday. The age range is unchanged from 3 months to 102 years of age. The age range of 20 to 49 years of age is ever so slightly inching up, now at 54%, which is 5,963 of the total number of cases. And for gender, that distribution remains the same, 51% female, 49% male. And for hospitalizations, we are now at a total of 1,627 of the total number of cases have been hospitalized. This is 15% of the total number of cases. And of the number hospitalized, that includes 451 individuals that have been admitted to the ICU. This number is 4% of the total number of cases and 28% of the total number of those hospitalized. As of June 21st, the county has surge capacity for hospitalization at 34% and for ICU admissions at 38%. Regarding race and ethnicity of all cases, we have data for 83%, which is 9,173 of the total number of cases, which means we do not have a race and ethnicity data for 17% of the total number. Of those for whom we have data, 6,137, or 67%, are Latino or Hispanic, 1,933, or 21%, are white, 569, or 6%, are Asian, 358, or 4%, are Black or African American, 83, or approximately 1%, are of multiple races, 79, or approximately 1%, are Native Hawaiian or Pacific Islanders, and 14, or 0.2%, are American Indian or Alaskan Natives. Of the 338 deaths, these represent 3% of the total number of cases. Of this total, 40% are female, 57% are male. 320, or 95% of the total death cases, had underlying medical conditions. 17, or 5% of the total deaths had no underlying medical conditions. Regarding race and ethnicity of all deaths, we have data for 99%, or 336 of the 338, which means we do not have race and ethnicity for 2 of the total. Of this number, 143, or 43%, are Hispanic or Latino, 141, or 42%, are white, 41, or 12%, are Asian, 10, or 3%, are Black or African American, and 1, or 0.3%, is a Native Hawaiian or Pacific Islander. And our sincerest sympathies go out to the family and friends of those individuals that have reported to have lost their lives due to COVID-19 during this pandemic. The following slides show our data in a different way, with weekly number of cases on the left and the number of daily stats on the right for the past 14 days or more. So this slide shows the total number of cases, and as you can see, particularly in the past 2 days, and if you actually compare the 5 days with the exception of June 19th, we've seen an uptick in cases. Now, as it was reported last week, we had a delay in testing due to technical difficulties, as well as increased numbers of batches grouped together. So that explains some of the increase in this slide. In the next slide, this is related to hospitalizations. So as you can see, there is a slight downward trend in hospitalizations over the past 5 days or so. Next slide. This is residents that have been admitted to the ICU, and we do see increased numbers for the 18th and the 20th, but again, holding steady. Next slide. For the total number of deaths, we have not had any new deaths in the past 2 days, which is over the weekend, and we expect that number, we will see deaths later this week, including tomorrow. In the next slide, this is our epi curve, and this is important because it shows the onset of illness for all of our cases. And previously, we've talked about peaking between April 20th and May 8th. But again, with opening occurring actually with that the second highest peak after that point is where a lot of reopening occurred, and we expect that we will have new cases with reopening. In the last 14 days, all of the cases that would occur in that period have not yet been reported because individuals are in quarantine, and we will expect to see more cases during that period. So this is a very important slide to help us gain information about how we're doing in terms of reopening or other major events occurring. In the next slide, this slide is actually related to tests. Now, for this slide, this is showing tests for the past couple of weeks, but look particularly at the last 7 days, and for the 17th and the 18th. That again is due to the increased batches of tests and the delay due to our technical difficulties. So in this particular slide, when we look at our trigger number 1, which I'll talk about when we show the triggers for how we will manage reopening, this supports trigger number 1, which is comparing the percentage of positive tests in the last 5 days compared to the previous 5 days. And as you can see, in the last 5 days, those numbers are much higher collectively than the prior 5 days, which is from about 6/12 through 6/16. So this is, we don't count this as an actual abnormality because there is inconsistency in our testing, and that is a statement that's included in the actual definition for this trigger. In the next slide, it relates to outbreaks, and as you can see, we, before today, we had 7 outbreaks on the books, and yesterday, there were 3 additional outbreaks in the community reported, so now we have a total of 10 outbreaks in the past 7 days. Next slide. So this shows the overall dashboard for all of our triggers. I've explained number 1, number 2. We've explained that. We are now at 10. On Wednesday, if you go back 2 slides. On Wednesday, next. On Wednesday, the outbreaks for June 16th will drop off, and we will then be left again at 7 outbreaks if there are no new outbreaks in the community reported. Please advance to the next 2. Yes, thank you. So this overall, we are green in all of the other triggers, and we continue to monitor all of these very closely. Next slide. I think that is our last slide. So now I would like to share with you outbreaks, overall report on outbreaks that have occurred since the COVID-19 pandemic began. We have had 120 outbreaks in congregate settings and community settings. And to provide context for these outbreaks, of the 120 outbreaks, 61 or 51% are now closed and are inactive, meaning there have been no cases in the past 14 days or longer. And of the 120 outbreaks, 59 or 49% are still active. The 59 active outbreaks include 17 outbreaks in our skilled nursing facilities, and there's a total of 86 total in the County of San Diego. We have had 1 outbreak in this group setting that became inactive since yesterday, and no new outbreaks reported since yesterday. 20 of the 59 active outbreaks are in non-skilled nursing facilities, or 1 outbreak became inactive since yesterday, and again, no new outbreaks reported since yesterday. And lastly, as you've already heard, we have had 3 new outbreaks reported in our community settings, and we now have a total of 22 of the 59 active outbreaks. We've talked about the triggers, and again, trigger number 2 related to the outbreaks, that is for the past 7 days from June 15th through June 21st. So as we reopen, people are interacting and gathering in larger numbers outside of their households. So we have seen what that looks like in the media. Following the primary best practices to prevent the spread of COVID-19, we want to continue to encourage the public in general, businesses and work sites to implement good hand hygiene and sanitation practices, to maintain social distancing, to wear their facial coverings when out of the household, and conduct screenings for temperature, symptoms, and exposures at work sites. These non-pharmaceutical interventions are our best hope to control the spread of COVID-19. The virus remains alive and dangerous throughout our community, and we are seeing cases, as stated earlier, in our younger population who have more of a tendency to feel invincible. Now more than ever, it is vital that we take precautions to guard our personal and collective health. And we thank everyone for the part that you are playing to support this effort. Now please welcome back to the podium Chairman Greg Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Bridget Nisa with NBC7, please state your question.
Hello, thank you very much. My question is about the threshold. You mentioned that it's been a number of days we've been over that, those trigger points and that threshold to pull back. Since you're not triggering at this point, are you working on coming up with another metric to determine if the county will make adjustments to scale back? Or how are you looking at that moving forward?
Okay, let me ask Dr. Wooten to go ahead and respond.
Thank you for that question in terms of what will we be doing in terms of scaling back. Supervisor Fletcher was very clear last week and again today that as we reopen and with these measures or triggers that are becoming abnormal, particularly with our outbreaks, at this point, as more guidance comes from the state, or if additional guidance come from the state, we will look at holding off until our numbers improve in that regard. So that's the action that we are taking. We are implementing a public education campaign for the use of facial coverings that will begin in part this week. We have an infographic that we'll be disseminating. And just in general, the education to various businesses if there is a commonality in the businesses where we see an outbreak. So those are the actions that we have taken and plan to take over the coming week. Thank you.
Okay, the next question, please.
Matt Hoffman with KPBS, please state your question.
Hi. First, just to be clear, you guys are attributing the 7% positive test rate and the highest daily total to the inconsistent and delayed results?
Why don't you go ahead and ask your question, because I'm sure Dr. Wooten can respond to that when she comes up. Is that the question?
Oh, sorry. Hopefully you can hear me. I just want to be clear. I mean, this is 7% positive rate we're seeing in the highest daily total over the weekend. You guys are attributing that to inconsistent and delayed results.
Okay, Dr. Wooten.
Thank you for the question again. Can you, staff, please show the triggers again? What we are contributing to an inconsistency in testing is the variability in testing that has occurred over the past week, and that's why the first trigger is at 72%. I didn't hear all of your question. You said 7%? Can you ask it again?
I'm talking about just that we saw that 7% positive rate yesterday coming out of the totals. And you guys are attributing that to these delayed results, not necessarily a spike in cases.
It's not 100% if that's the case, but in part, yes, we are attributing some of that, but we're not absolutely sure if it's 100% related. Going forward for this week, since we have all of the tests that were delayed or they have been tested going forward, the hope is that we will see a consistent number of tests close to what our target is over the 4,950 and closer to the almost 6,600 tests. With that consistency, the percentage of positives over new positives over the overall number of tests performed will give us a clearer picture of what our positivity rate for tests will
Gotcha.
be.
And then
yes.
just one other question I had. I know summer officially kicked off over the weekend, and some businesses and events that sort of hinge on large gatherings like the Kaboo Music Festival, Legoland, SeaWorld are sort of in limbo right now with our pause on reopenings. Do you guys have any idea if we'll see these large events resume this summer in San Diego County?
It depends on the guidance that we get from the state of California. So, and that's the case with all of the guidance that we've received. We really have not held back on any of those guidances. We've included them in the health officer's order. But again, as Supervisor Fletcher stated, if any new guidances come out, particularly this week or next week, we will hold off on implementing those until our numbers are more consistent. But I have no idea when Legoland or events of that nature will open up. That depends on guidance that we obtain from the state.
Thank you.
Okay, next question.
Brandon Lewis with CBS 8, please state your question.
Thank you. We noticed that there was a large percentage in cases that are happening or coming in from the northern communities like Poway, Vista, and Fallbrook. And I'm wondering if contact tracers are finding any difference in where and how these people are contracting the virus compared to early on when we saw the big spike in South Bay communities, and local officials there were saying many of them were essential workers.
Okay, Dr. Wooten's going to respond, and probably Dr. McDonald.
I think I heard your question correctly. I don't think there's been a noticeable difference from the contact tracing perspective in terms of responsiveness to our questions and the number of close contacts that we're detecting from different parts of the county. Again, I can have our staff look at that a little bit more carefully, but certainly anecdotally we haven't seen that. Is that the gist of your question?
Yes, essentially, if there's any particular reason that some of these other communities might be seeing an increase in cases now versus early on with some South Bay communities.
Well, again, what you're asking about is what are some of the underlying trends that we're seeing? We're certainly seeing an increased number of cases in the southern part of the county compared to the rest of the county. That trend continues. The other thing that's been a trend, I would say, in the last 2 months is that the individuals who are over the age of 60, the number of cases that we've seen has showed a slight decrease over time, and the individuals who are under the age of 40 actually has had an increase over time. Again, that may be playing a piece in the demographics by region of the county, but that is, again, certainly a discernible trend that we've seen. We produce our weekly report every Tuesday, and we do look at that by region. I think you'll see in the report that we put out tomorrow that the southern region has clearly a higher rate than the other regions of the county. And then if you look closely week to week, you may be able to discern some trends in the other regions. The problem is that there is a delay in reporting, so a lot of what's happening in the last 14 days won't show up in those trends over time. It's very clear what happened more than 2 weeks ago, but what's happening right now might be a little less clear. But I would ask you to look at some of the data that we put out tomorrow, and if that doesn't answer your specific questions, then please come back on Wednesday and ask us some more.
Thank you. And if I could, just want to see if you could.
Go ahead. I'm still here. I was walking away, but you got me.
Sorry. I just wanted to see if you or perhaps somebody else would want to respond about the governor saying that he believes we're still in the first wave of this, not the second wave.
I think I'll let Dr. Wooten respond to that rather than let me comment on what the governor was saying.
So the comment that the governor made today, we are clearly in the first wave. We are not out of the first wave. And what comes in the fall, we just don't know. We won't know until we reach that point. And right now, the one thing that we can say for sure is that we are in the first wave, and things are not slowing down. So as we continue to reopen, our numbers are actually maybe even going up a bit. So it is very important that everyone utilizes those best practices that we've shared and talked about. Good hand hygiene and sanitation, social distancing, wearing face coverings, and ensuring, particularly in businesses and the work sites, that screenings are taking place, including temperature symptoms and exposures to others that have been diagnosed with COVID-19. Thank you.
Okay, let's go to the next question.
Sasha Fu with KUSI, please state your question.
Yeah, I have a couple of questions. One is the 3 new community outbreaks. Where are they? Can you characterize the settings? And now they join a group of 10. Is there any trend in terms of the kinds of settings, whether they're homes, businesses, restaurants, or what?
Okay, Dr. Wooten will respond. Dr. McDonald will respond.
Sure. The most recent 3 outbreaks were all in business settings and in different parts of the county. I would say that one is a construction type business, one is a retail manufacturing business, and the other would be a retail business. So no trends specifically amongst those 3. And actually, I would comment that out of the community outbreaks that we've had over time, it does seem to be in different venues, and all but 2 of those to date have 10 or fewer people as part of the outbreak, including these last 3. And that's good news. They're relatively small outbreaks. And again, that's a little bit of extra context to give you a sense of scale.
My other question is about the, I guess, Dr. McDonald, you said something about the numbers are trending towards younger people now in the last couple of months. 20 to 29 is the largest component of the cases, then 30 to 39 the second largest. If this continues to be one of the larger groups of infections, is that what is your assessment of the role of reopening, the relationship of reopening businesses and our outdoor activities to that infection rate among that group, and the protest activities that took place in the county over the last couple of weeks? Is there any way to tease out, what is responsible for the rise in numbers among this younger demographic?
Well, I think that the first part of that question is you need to look at the demographics of the county itself. There are a lot of people who are in those age groups who live in the county. So I think that is one contributor. It's, again, from the epidemiologic perspective, it's individuals who are younger tend to have less severe illness, and I think that's clearly reflected in our numbers that are being seen in terms of the stability of the number of people that require hospitalization and ICU care. And younger people are more active. My 20-year-old gets out a lot more than I do at my age, so I think that they have a little to do with it. But when you try to drill down on specific activities, we haven't seen any specific trends. Certainly, we have seen no outbreaks related to any of the protest activities, but I think if you look at the people who are out in those protests, they span to the age group that might be reflective of those who live in San Diego. So I think it's a little hard to kind of connect those kinds of dots, but I have to say that is one of the things our epidemiologists try to do. And so if we are able to come up with a specific trend after analyzing this information, we will certainly communicate that to the public because it's actionable. But we haven't seen any of the kinds of specific trends I think that you're trying to get at.
And finally, we're waiting for further guidance from the state on new reopenings. It's my understanding from our briefing last week that county has decided to put the pause button on that. So to be specific and clear, what's the next phase of reopening that we have paused? What would be those entities?
I'll defer that one to Dr. Wooten because she's been working on that much more than I have, certainly.
Thank you, Dr. McDonald. We have no new intel as to what's coming in the next week or so. We do know what is still left on the table to reopen, and that certainly includes events that are associated with large gatherings. So, but we have no idea when those guidance will come out. So we are waiting, and you will know as soon as we know, because obviously it will be publicized from the governor's office and then placed on the California Departments of Public Health website as to what guidances are new. And they actually do have a website with all of the guidances that have been issued to date. And then they also have information about what's next. So I would encourage everyone to take a look at that. But we have no intel as to when those guidance will come out. Thank you.
Okay, thank you.
Paul Sisson with the San Diego Union Tribune, please state your question.
Thank you. What common exposure routes have contact tracers identified among the 628 positive tests that came back over the weekend? And I wonder if you can tell us a little bit more about how delayed those results were. Were most of them reported to the county within a day of turning positive, or were a lot of them delayed by weeks? Can you give us a little more information on how delayed this information actually is?
Dr. McDonald's going to respond.
I think there were a couple of questions there. You may have to remind me on the first one. On the delay question, I don't have specific statistics on that. I can say that most of the cases had a turnaround time that was on the order of 3 to 4 days, so relatively quick, but there are some that are longer. I just don't have that information available easily at this time. I don't know if any of our other colleagues do, but we can certainly get that information back to you. These batched tests, again, the specific sources that they were reported from would have to be drilled down on to look at the actual number of days that they were delayed. Our epidemiologists, of course, when they get a positive test, act on it certainly within 24 hours to be able to initiate the interview and to establish this contact individual close contacts. They're certainly asked about all of the types of activities we've talked about, whether they've been at protests, whether they have been out to businesses, certainly the workplace that they're in, and any social activities that they've been involved in. And then there are two categories that we're concerned about. One is, could they have exposed others when they're infectious? That is the thing that drives us to going to identify close contacts. And then the other set of questions that we ask have to do with what you did in the last 2 weeks that might have resulted in you being exposed. And we certainly spend most of our time looking forward, trying to identify people who need to take action. And then, of course, looking back historically is useful, but is always, I think, a little harder for people to give us full information on. And sometimes people give us information over time. Certainly when I'm interviewed a second or third time about something, I sometimes remember something that's important that I did a while back. But to specifically ask about the types of activities that the individuals who are identified over the weekend, if those types of activities are different than the activities that folks maybe who were reported positive weeks or even a month or two ago. We have not done that type of global analysis, but it is something that we can look into and get back to you on.
Okay, and also I wonder, Supervisor Fletcher talked on Thursday about increased enforcement actions. That was mentioned briefly today, and I was a little confused about whether any specific enforcement actions were actually taken over the weekend when, say, people were getting infected in certain locations or not following social distancing or face covering recommendations. So can you guys be a little more specific with, were any actual enforcement actions taken this last weekend, and if so, what were they?
I am personally not aware of enforcement actions. The enforcement actions tend to be sort of out of my lane, although we would certainly be able to identify a potential area that needs to be investigated further. But I'm unaware that any of those led to specific enforcement actions over the weekend. Somebody might have more information than I do on that, Paul. I'm sorry.
So Paul, we might get information from individuals, and then we will act on that, whether it's through our Department of Environmental Health or our contact or case investigations to follow up. So we get emails from time to time about that, and that's the process that we follow. And also, when we started having the various entities that were opening up. As Dr. McDonald stated, once an individual is positive in the case investigations, we do ask about if they have been exposed or participated in protests, but we also ask about any other industries like eating in restaurants or work site, trying to, it's very difficult to do, but trying to marry up any exposures to the reopening of various businesses. So we try to do that as well with the case investigations and also with our contact tracing.
Right, I understand. I'm just asking, are there specifically any enforcement actions you guys working with law enforcement took over the weekend in these situations as the numbers are literally rising?
No, I am not aware of any enforcement that was conducted in collaboration with law enforcement.
Thank you.
Okay, we have one final call-in question, and then we'll go to the texted questions.
Derek Stahl with 10 News. Please state your question.
Hi there, thanks for taking my call. I think this is for Dr. Wooten. So you talked a lot about trigger number one and the delays and sort of the glitches that are associated with that and why we're not really counting that at the moment. But earlier in the press conference, Supervisor Fletcher talked about, these numbers, these rises over the weekend being concerning. Can you just kind of help me understand what numbers are we concerned about and what numbers are we chalking up to technical glitches and delays? Are we concerned about mostly the positivity rate right now and not so much about the total case numbers because that might be associated with glitches and delays?
So there are several areas that we are concerned with, certainly the increased number of cases, but the first trigger is the comparison of the average number of cases over the last 5 days compared to the prior 5 days. And I think I went into great detail. If you can show that slide, if staff can show that slide. That is the slide that is related to trigger number one. Now, we had over 5,800 cases tested yesterday, and again, I believe about 5% of that number was, it was a 5% positivity. And let me go to, if you can show that slide. So these are tests. Again, 5,891 tests there. If you go to the slide that was shown in Supervisor Fletcher's, which is a rolling 7-day. And it depends on how the question is asked and how the data is depicted. So that slide is a rolling, this one right here, is a rolling 7-day average. And that is 5%. Is that 5%? I can't see very well. Yes. So this is a rolling 7-day average. It's the past 7 days. Tomorrow will be the past 7 days, and so on and so on. So that's what this slide depicts. When we look at again, the trigger number one, that's looking at the last 5-day average, comparing it to the prior 5 days average, and looking at the percentage change. And that's the one that is 72%. And again, in the definition for that first trigger, it is related to the percentage change in the face of non-consistent testing. And as I tried to point out, the past 5 days was different than the prior past 5 days. So we would expect that to be abnormal, an expected abnormality, not a pure abnormal trigger as number two, which is related to outbreaks. Does that explain?
Okay, and when will you expect trigger number one to reset, and when will you start sort of considering the number? Because you seem to be kind of discounting that number right now.
Well, we aren't discounting it. It's in the definition, clearly in the definition of when it will be abnormal. Over the next week, if we have 5,800 tests performed for the next 7 days, that's consistent testing. And that's what we want to see. a consistent number of tests performed every day for any given week. And as you can see, if staff can show the daily test, on some parts of the week we had 10,000 tests, and then in other parts of the week we had 4,000 or 5,000 tests. That's not consistent.
Gotcha. And then separately, has the county mapped out in advance the actions it will take in response to triggers going off? And what would it take for the county to consider actually shutting down businesses and scaling back ones that are already open?
Well, we hope that we won't have to get to that point, but again, there are actions still that we will take, particularly if there are restaurants where we see primarily our community outbreaks. And again, we would not shut down the entire restaurant industry, but we would work with those restaurants that have associated outbreaks, and they would be closed just by the normal process until they can implement appropriate infection control and prevention measures. And that's the process we used with the restaurant several weeks ago. And that's the normal process when there is an outbreak of this nature.
Gotcha. And last question, is there a particular trigger that you monitor most closely? Like, this one of the 13 is the most serious, and if that were to go off, that would really prompt, major action.
We monitor all 13 very closely and every day. As was stated, the ones that are shaded in blue, those are kind of primary metrics that we look at: community outbreaks, ICU capacity, and personal protective equipment. Also, if we have one or more triggers in 2 of the 3 columns, that would be a cause for concern. And actually, if any given one of these 13 metrics are abnormal, we would look at what else is impacting it or feeding into it or associated with it. So we monitor all 13.
Thank you.
Thank you.
This is very much in line with the questions you were just answering. It's from Artie Ojeda with NBC. Last Thursday, the county made a huge deal about a community outbreak trigger, even calling an unscheduled briefing. Now we've had 5 straight days of community outbreaks. What meaningful action is the county taking beyond waiting for state guidance? It doesn't seem as though you're taking any real action as a result of these community outbreaks.
Well, I'm sorry that you feel that way, Artie. And we have not had straight days. We are trying to get that outbreak slide up so we can see that and show what actually has happened. We had 3 outbreaks on the 16th of June, then on the 17th, the 18th, and then yesterday for a total of 10. And as stated by our supervisor, Nathan Fletcher, last week, the action that we will take is that we will, if you can go to the actions that we are taking is, number 1, education. Number 2, getting the word out about the practices that need to be in place, and following the procedures that we would normally do when there is an outbreak in a specific facility. So as stated, the 16th we had 3, on the 17th 2, 18th 2. No outbreaks for the 19th and 20th, and yesterday we had 3 business outbreaks, for now a total of 10. So those are the actions that we are taking and will continue to take.
All right, thank you.
We're not closing anything down, Artie, if that's the response you're looking for.
Okay, and this question is from Taryn Mento from KPBS. Can you provide a little more details on what the delay is in reporting that is causing this batching? Is it a specific lab, hospital, technical problem?
Well, some of it is a technical difficulty, as was explained in immense detail last week. We had technical difficulty with our equipment. And then we also had delays in batchings from the state. So those were the issues that we had, and we've now caught up. And there's always the chance that something will happen. And so we just have to be prepared and adjust and be flexible when these glitches occur.
And this question is from Carlo with Channel 8. A viewer asked me why schools need to be closed since we're not seeing children die from COVID-19.
Well, schools were closed because the governor issued a stay-at-home order, and also because the San Diego County Office of Education, collectively with the 42 school districts, in consultation with our health department, decided that the schools would be closed. So once we get guidance from the state, and we have actually received guidance from the state, which stated that schools could reopen as early as June 12th. Whether a school actually opens is really based upon the district and their school board in terms of how the school opens. So, yeah.
Okay, great. Thank you, Dr.
Okay.
Pico.
This next question deals with enforcing stay-at-home orders, and Supervisor Fletcher is going to respond.
And this question is from Mike McKinnon from KUSI. We are counting on folks to comply with the public health orders, what Supervisor Fletcher said last Thursday. Public health orders have the effect and impact of the law. If wearing a mask and not allowing San Diegans to host people in their private homes is the law, how do you plan on enforcing it?
Well, as we've also said from the beginning of this, it shouldn't be the job of law enforcement to have to go out and enforce these things. And so we are counting on the public to buy in and support. And the reality is there are great challenges here because there's so much misinformation that gets shared about the validity of face coverings. There's so much misinformation that gets shared about the danger of coronavirus that I think it is natural that a lot of people don't maybe take seriously what is at stake. And I think that mindset is certainly what's contributing to a significant increase in cases, both cases, percentage of positives, and outbreaks. And from the beginning, our goal has been to have a smooth and steady and consistent recovery. But in order for that to be a reality, we really hope that we can get the overwhelming majority of the public to understand that the measures that are put in place are designed to allow us to reopen, are designed to allow us to get our economy going, are designed to allow us to be in a position where we can safely get large sections of our life back and back in place. And so we continue to try to make the case to the public that the measures that are put in place are designed to not only keep us safe and protect life, but slow the spread, which will allow us to continue moving forward. And we hope that we can continue to see increased adherence to those guidances.
Well, that does it for today for the questions. Just a reminder, we will not be holding a media briefing tomorrow because we have a Board of Supervisors meeting starting at 9 a.m. at which we will have an update on the COVID-19 status. The meeting will be streamed live on various social media platforms, including Vimeo, Facebook, Twitter, and YouTube. And again, that meeting will start at 9 a.m. You can also watch on Cox Channel 24 or 19 Spectrum Channel 24 or 85. There's also a call-in line to listen live to the Board of Supervisors meeting, which is the phone number is 619-531-4716. That's 619-531-4716 to listen to the Board of Supervisors meeting live. But this is a listen-only line. There's no two-way communication. And then again, for our ongoing information, please visit our coronavirus website, which is coronavirus-sd.com. And we will see you on Wednesday. Until then, stay safe, San Diego. Thank you.